It looks like we are live on Facebook, you guys. Let me move the live stream around. So we're hitting a couple different platforms. Sure, there's a better way to do this, you guys, after all these years. But I haven't figured it out yet. And if you guys are in the membership, feel free to jump on live. I'm gonna post the Zoom link again. Let me pull up some other stuff and we should be ready to go. Hey, Brandon, you ready?
Yep.
Okay, so today we have Brandon Ames, who is CEO and founder of Anacell Biotech Company. Um, he's also a lifelong horse person and has done almost everything and anything under saddle, except for vaulting. He's never vaulted. Well, I'm sure he vaulted, but not like that.
Yeah. It wasn't intentional, that's for darn sure.
Exactly. And so
Short of the Richard Shrake clinics that I used to go to as a kid. But yeah.
Richard, rest his soul, Richard Shrake.
Yep. Yep.
He had some amazing clinics.
Yes, he did.
So life has twisted and turned you, and now you're this science geek person that is doing regenerative therapy with um, equine placentas only equine placentas.
Only equine. We used to do canine for canine and equine for equine, and a bunch of California veterinarians went through and changed our mind on that. They found no efficacy difference between the canine or the equine amnion, and we've used it on fish and chickens and
Cats.
lizards and cats and dogs and lions and tigers and bears. Oh
Oh.
my, I mean, yeah.
That's
So,
awesome. Well, I can't wait to hear it, and I'm excited. I had a client who did this with her cat who was losing an eye in and she went to a vet in Fresno and she was like, "Hey, have you ever heard this equine stem cell stuff?" I'm like, "Yeah, a little bit, but I didn't know they did it for cats." And that I was going to be extracted. It was pretty dead and just mangled. In 48 hours, that cat's eye was absolutely normal. And I was like over the moon with that. So that is part of my passion to reaching out to you, Brandon, is because I want to know more because I have a dog with neurogenic KCS, which is a nerve disorder in the face, and he's losing his vision in his right eye. So maybe this will help him.
yeah, it's been a pretty amazing journey as far as getting to know this technology and we've been at it for about 10 years now. I got introduced to the technology back in 2013, began in 2014, and got asked to read a business plan, and I needed another startup like I needed a hole in my head. And so anyway, after turning it down 3 times, I always tell everybody that this was a God-given adventure because in 2009, my mother and my sister lost 2 horses due to a lethal interaction of corticosteroids that chemically foundered them and dropped them through their feet. And I might have said some things that probably I shouldn't have said, based on my frustration that here we are, the 21st century, and we're still using steroids for chronic indications. And I think steroids is probably one of the greatest inventions and discoveries on the planet for acute issues. But when we start using them for chronic issues, it becomes less than positive in terms of long-term outcomes. And so,
Yeah, I love that because we should have options. It seems like our medical field has not, our conventional medical field has not progressed or advanced, which has left the door open to holistic and desperate measures of people having absolutely nothing to lose and everything to gain.
yeah. Well, basically, we extend the active life of animals through the use of regenerative products collected from equine birth tissue. And so we're in the recycling business. We take what God made all living things on this planet from, and we turn them into regenerative treatments for tissue-based indications and in dogs and horses and lions and tigers and bears.
Well, let's see what you've got today. I'm crazy excited about this, and I do believe in the power of the placenta. I know one of the longest living dogs would feed on placenta, and I believe that dog lived to be 30.
It doesn't surprise me. My dog was a 125-pound Rottweiler Mastiff German Shepherd Wolf, and he was 125 pounds of monster and an amazing dog. And he lived to be 19.
What? Oh my
And
gosh.
yeah, and I can neither confirm nor deny that he may have been pickled in our product, but it served him well, and he was still getting up and down off the tile floors at 19. And so,
Okay.
but
I'm pretty
yeah,
excited about this.
well, give you kind of some of the highlights of the science. And so, like I said, we support active life of animals, and the active life piece of it's really kind of a big deal for us. And so, if your animals aren't active, you're not active, and they kind of go hand in hand. And people who are animal lovers and have animals as companions, whether it be horses or dogs, they tend to be active and outdoor people. And if your dog's laid up, you're probably not going on a walk by yourself, or you're probably not at the barn riding your horses. And so we think that the supporting of that active life goes far beyond just the four-legged animals, but extends to the two-legged animals as well. And so these regenerative products, they literally come from the amniotic and placental tissue that comes from that surrounds that fetus. And we know, based on some science that was done by Stanford back in 2015, that fetuses don't just grow from the inside out, they grow from the outside in. processing that amniotic fluid through the GI tract and through the respiratory tract, pulling from it all the basic building blocks of tissue growth. And so when we look at what's in amniotic material, you've got all the structural components of tissue growth. And so mesenchymal and epithelial stem cells, you've got all the basic building blocks of extracellular matrix. And so extracellular matrix, if we look at this slide a little closer, this is a cell wall. So if this is a cell, what's in between the cell is the extracellular matrix. So if you ever wondered where the collagen was or where the hyaluronic acid was, all of that is kind of like the mortar between the bricks. So you've got cells that actually feed material into here, in between the cells themselves, and these integrins, they glomp onto it. And that's what makes our connective tissue. And so hyaluronic acid, fibronectin, proteoglycans, all the collagen substrates, and then all of the growth factors, the chemokines and the cytokines. And so when we've looked at this technology at North Carolina State University, what they've found is about 18 times the concentration of cytokines you'd have in a normal dose of PRP. All the collagen substrates, highest concentration of naturally occurring hyaluronic acid known to exist. When I started giving this presentation, we were able to identify in human amnion about 190 regulatory proteins, and now we're at 311. And it stands to reason. It's basically what grew you to begin with and is responsible for the single greatest growth spurt any living being will ever happen is in utero. And so ultimately this kind of demonstrates a consistency in dosing that autologous-based products that come from the animal and go back into the animal, things like PRP and stem cells, those are all dependent on the health and age of the animal, whereas this technology is going to have a consistency in dosing that other products aren't going to, other regenerative type treatments aren't going to have. And so we've got an analogy that we look at and basically talk about is in terms of a tornado rolling through a Midwestern town and knocking over a brick building. And so our tornado analogy, if you think of this in terms of the wound healing cascade. Now, the wound healing cascade, if I back up just a little bit, there's 4 steps to it. Wounds heal, all wounds. Doesn't matter whether it's a tendon or ligament or a joint or a superficial wound. All wounds go through 4 steps. They start with hemostasis. You got to stop the bleeding, and then they go to inflammation, which is basically just a call for help. And then there's the proliferative repair phase, which is it repairs it, and then it remodels it, if you will. And so all wounds go through those 4 steps. And so if we look at our analogy here, the bricks are the cells, the mortar is the extracellular matrix that's in between the cells, and the growth factors are kind of the construction workers, specialty contractors, project managers, and architects, and all that. And so the first thing that happens is after that tornado rolls through, mom and dad, they come out of their storm cellar, they turn off their water and electricity, and we call that hemostasis. So they get their water and electricity turned off, and you see them see people that after a tornado they're walking through picking up their lives, and pretty soon they realize they can't fix it, and so Dad, he's got to have something to do. So he goes and he starts stacking bricks, putting bricks on top of one another. And mom, she picks up the phone and she calls FEMA and the insurance adjuster, and she takes her cell phone and she makes that phone call. And so if we think of pain as neurological signaling, inflammation is nothing more than cellular signaling. It's a call for help. It's a call to send me the material I need to fix this wound. So mom, she makes her phone calls and nobody answers her call. And Poppy, what happens when you call your mama and she does and or your mama calls you and you don't answer her phone call?
Uh,
Pretty soon she gets mad, right?
yeah.
Yeah. And so all of a sudden good inflammation turns into bad inflammation. So now mom's mad and she's kicking bricks and throwing bricks, and dad's got his head down stacking bricks, making scar tissue because he's only got what he's got to work with. And that's what happens in these wounds. And nobody can get there in which to help because I mean tornado rolled through and so you're kind of isolated. And that's what happens in these distal limb wounds in horses and dogs and in these joint areas where there's just not enough blood flow in which to actually provide all of the material to regrow the tissue the way it was originally. And so what we do is we answer that call and we airdrop in all of the material needed to grow that tissue back exactly the way it came off. And so we're able to repair the outside, and then we're able to go in and remodel the inside with that material and restoring it to the same uh, functionality as what it was initially. Does that make sense?
Yeah, that's a great analogy. That makes so much sense.
So, in terms of our number one value here at the company has always been safety. And so we've got a closed facility here in Chandler, Arizona, in which people bring us their mares in which to foal out here at the Miracle Ranch. It's a dedicated facility so that we can retain the custody of the product all the way to the lab and know the source of where it came from. We do about $3,000 in lab testing on these animals before they come on to the ranch here, and testing for hepatitis and herpes and parvo and all the different communicable type uh, things that could affect other animals. And we do testing to the American Association of Tissue Bank Standards in-house, and then a bunch of third-party testing on the final product prior to release. So,
I think it's really interesting because horses don't get a lot of cancer. Um, so I see a huge benefit in that aspect that you might actually have an anti-cancer product too.
yeah, amnion's naturally anti-tumorigenic, and we've not done a lot with neoplasia at this point. Things like mast cell tumors and some of those types of things. And in small animals, we've been able to use the product on, and it's really beneficial if you're having to debulk a tumor or surgically remove it using the our stem wrap line of product, which is a bioscaffold to supplement the body and provide the material needed to grow that tissue back. But there's Johns Hopkins University, University of Houston. Let's see, Wake Forest, Stanford. They're all utilizing these products in which to treat various forms of neoplasia and continue to experiment with them. And so there's definitely going to be a place for that down the road.
That's so exciting, and you're ahead of the game. That is incredible. I'm just so excited about it. Now, when you talk about amnion, are you actually talking about amnion fluid or the placenta itself, or both?
Uh, we 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 eat the whole elephant here. So we use all the aspects of the placental tissue in which to create different formulations for different indications. And so um, the products are preserved and sterilized, in which to terminally sterilize so that we know that we're not going to be passing on anything, or aseptically manufactured in which to preserve certain growth factors and cellular components.
So when people bring mares to you to pull out, they're using your own expertise as a midwife. So they're paying for that, but you also get to harvest.
Yeah, so it's a win-win for everybody. We're able to give back to the people who bring us their mares. We are able to give back to them some treatments and trade, if you will, and they really appreciate the fact that somebody's willing to spend the late nights and late hours, and we're very fortunate. We've got an internship program that is that's second to none. It's with a charter school here, a high school here in Arizona. A couple of years ago, it was ranked the fifth best high school by U.S. News and World Report. So a bunch of really smart kids that are book smart, but maybe don't have all of the real world applications of what they've learned out of those books. And so we bring them onto the ranch here, and we spend a lot of time just beating the millennial out of them. And so um, they spend a lot of time cleaning stalls and maintaining the ranch, and it works out really well. They get to uh, experience babies being born and all that it takes. Their advisor told me, she's like, all of these kids are going to go into some form of science, either into healthcare or into biotech, and I want them to know that biotech doesn't come on a FedEx truck.
Yeah,
And so we teach them that biotech doesn't come on a FedEx truck.
that's so funny. Yeah, and
Yeah.
do you actually do the breeding there too, or are you just the end product?
We're just a birthing facility for these mares. And so my wife, she never once thought she was ever going to be a horsey midwife, and she calls it the equine maternity spa, because these mares get brushed and loved on every night. Everybody gets is out in grassy pastures during the day, and get their full fill of grass during the day, and then brought in at night. So
That's awesome. That sounds amazing. And it's interesting. I never would have thought about testing for herpes, parvo, and hepatitis. But it makes sense. There's a lot of horses that do have this underlining herpes type exposure. Do you see that very often?
well, herpes 2 and 5 we see pretty often, and it's pretty ubiquitous. It's non it's asymptomatic, and so it's not like it's something that is going to be an issue. It's kind of like most humans carry some form of the herpes virus, and it's asymptomatic. Maybe they get a cold sore once in a while, but for all intents and purposes, it's asymptomatic. With with horses, herpes 2 and 5 are that way. Um, but our concern is more with type 1 and type 4, making sure that we don't have any exposure to that. And because we're an allogeneic product coming from the animal and going to a different animal, or a xenogenic coming from a horse and going to a dog, we're kind of hypersensitive to a lot of these things, making sure that everything tests clean. So,
That's great. Yeah, those zoonotic aspects. And and what about parasites? Is that a
um,
concern?
yeah, parasites, not as big a concern in terms of amniotic tissue. We want horses that, I mean, we want to make sure that we're not bringing things onto the ranch, and so we test for parasites, and they may need to get a dose of worming before they show up. But for all intents and purposes, everything shows up pretty clean.
And Brandon, one more thing about the deworming is, do you take in consideration that MDR1, that for the stock type dogs that you avoid ivermectin, do you think that could actually be a transmitter?
We're pretty cognizant of just warming protocols in general, based on the fact that these are pregnant mares, and so we want to warm with something that's safe, that's not going to cause any issues with that fetus, as close as we are to birthing, and so.
Interesting. Okay. So show us what this actually can do. Like, why would you consider this? I gave the example of the cat losing its eye and it came back miraculously, like jaw dropping.
Yeah, well, so regenerative medicine, it's been really interesting. Regenerative medicine is, over the course of the last 20 to 30 years, has really been just kind of another arrow in the quiver of the veterinarian. And so our traditional medicine, Western pharmaceutical based medicine, it's been very symptom based. It's using pharmaceuticals and surgery in which to diagnose, treat, and prevent injury and disease. And so um, our alternative veterinary medicine, it's kind of symptomatic as well. It's dealing with symptoms. And I people have oftentimes said, well, Brandon, you must be really an Eastern medicine kind of guy. And I always tell them, I'm like, no, I'm not as much in Eastern medicine. I'm kind of East meets West in Hawaii. It's kind of how I see things. And um, I think there's benefits to both sides, but we've really seen an emergence over the last 5 years in terms of regenerative medicine based on it being outcome based. So we want to fix stuff. And so, pardon my French, Poppy, but we've got T-shirts made that we wear at trade shows that say "We fix shit," because at the end of the day, we're not interested in symptoms. We're interested in fixing the underlying cause of whatever the inflammation is, and solving that inflammatory event by healing the tissue that's involved in that inflammatory event, thereby removing the symptoms altogether. And some people don't like that. Some people like the symptoms. Some people's entire business models, whether are built on solving or treating symptoms, and it doesn't matter whether it's pharmaceutical companies or veterinarians or whatever, and we're fine with that. You guys do you. but we want to fix the underlying cause of what's going on. And so this concept of regenerative medicine is really starting to change. And I have truly regenerative medicine veterinarians who really approach things. They're like, I haven't got time to see this animal over and over and over again. It's kind of like chiropractors. I mean, there's chiropractors out there that that want to get you fixed and solved and moved on, and other ones that do manipulations over and over and over again based on that being what the person wants. And so but we really have this biology based versus chemistry based view on things as it relates to regenerative medicine, and a strong reliance on rehabilitation in conjunction with certain injuries. And so as far as some of the things that we address, and I'm hoping this comes through. This was from last summer. This was a dachshund that had some hind limb paralysis and was in a wheelchair for 2 years. So she got stepped on when she was 4 by a horse, and this horse stepped on her and um, severed her spinal column in a couple of different places, and so she had been in a wheelchair. And this is her in the going through, dragging her little feet and tail behind her. And we went through and treated her with it's called Animotion, and did an interthecal implant. So did an implant into her spinal column. This is her 1 week post, in which now she's got a pain reflex in both of those feet. This is her 2 weeks post.
Wow. After 2 years.
2 weeks, yeah, after 2 years. And this is 4 weeks post, in which she's got near full mobility. Now she's got full mobility. And we have treated just, I think we're up to 15 paraplegic dogs, and are just seeing unbelievable results in restoring a lot of their mobility where they just didn't have that mobility before. Um,
Brendan, does it
other,
actually, I've heard theories that the nervous system, the central nervous system, once it's damaged, you can't repair it, but you're defying this.
I don't want to argue with scientists because all I can do is provide evidence over and over and over and over again, in terms of what we've seen. We've had neurological horses that have had EHV1 who have been down in the stall, and we've treated them and they've gotten up and returned to full active lives, complete previous performance level returning.
Okay,
And
wait, stop the train, stop the train. So, so I do a ton of EPM horses and I do a few Lyme horses and some Sidewinder horses. Tell me, what do you do for them?
typically we would use a product called Restore Immune in which to treat those. And basically, what we're doing is repairing the damage done by the disease. Truly, as it's very mechanical in what it does, and very physical based, in which we're repairing the damage, in which to help improve those horses. Um,
Okay, and tell me
so
the cost. Talk to me about how much it is, how often, what kind of veterinarian can apply this? Like,
any veterinarian can apply it, and typically cost to the user is going to be 1 to 2 shots at $300 a piece,
okay,
in which to treat things like treat things like EPM um, uh, and I mean we're not something miraculous or anything along those lines. We don't win in all cases, but we win in a good majority in terms of helping to improve the mobility and functionability of that tissue, and that's ultimately what we're after is returning them to a more active life than what they had before.
Oh, I'm so excited. Thank you for this.
So, um, this is kind of where we started was in wound healing. And so this was in terms of severe necrotic wounds in dogs and horses. And so this is Tabby. Tabby was a young Rottweiler female spay mix. She had severe necrotic wounds. They were non-healing wounds. And basically, we went through and you can see in this picture here, I'll zoom in a little bit. They're placing the amniotic material on the wound itself. And then here they're injecting into the healthy margins just to speed the healing along. But you can see this is 3 weeks
That's pretty
from.
gnarly, whatever happened to that dog.
Oh, yeah,
Whew,
definitely. And this is 4 weeks.
that's 4 weeks.
4 weeks.
That's amazing.
So,
Can I do
but
this to my face?
I get we own the cosmetic patent, but we've not started doing anything with it yet. But my wife is you'd have to get behind my wife. She's pretty excited about this coming to market someday down the road. So, but Poppy, you have a background in horses. I'll give you some horse pictures here to look at. But this is a leg wound from from a gate, and you can see the wound there. We treated it. This is 44 days post. But where's the white hair?
I know. Look at that. It's so
There's no
clean looking.
Yeah, there's no white hair, and so
Well, and the
wounds
scar
like
tissue, like there's such minimal scar tissue.
right, and so you're never going to get proud flesh. I mean, on this one here, you can see just between day 9 and day 14, all of the hair that grew just in that 5 days.
That's so crazy.
And
Well, I
so
don't want
wounds.
hair all over my face, Brandon, but yeah.
The yellow you see here is basically the amnion breaking down and becoming part of the wound. I mean, it's becoming part tissue. And so the all of the yellow shading that you see here is nothing more than the amnion becoming tissue.
Interesting. That's impressive. I'm excited about this.
Um, and it doesn't have to be just wounds. We treat a whole host of other indications, things like fetlock cysts, and this was treated just sub-Q around the joint. We didn't even go in our articular with it. So basically, this horse was 3 out of 5 lame, 2-year-old stallion. This is at 70. He was sound in 70 days, but you can see just radiographically how that fetlock improved over 150 days.
And that was not a joint injection, it was a sub Q.
sub-Q around the joint.
Impressive.
We were pretty excited when we found that there was no efficacy difference between an interarticular or periarticular injection. And so here's an SDFT, a left front SDFT on a thoroughbred filly, and you can see the defect here. And this is 32 days post with a single application of the product.
Brandon, SDFT, what is that?
Superficial digital
Okay,
flexor.
I'm like, I'm spacing out on this. So it's a
Sorry.
tendon tear, and in 32 days, it's gone.
Correct. And this horse went back to the track at 90 days after the injury.
Which soft tissue can take up to 9 months.
A year. Yeah.
Yeah. That's amazing.
Exactly. This kind of a fun one. This was apparently, Poppy, in Lexington, they treat raccoons different than we treat them out west here. And I don't know whether it's a Davy Crockett or a Daniel Boone thing, but at the Kentucky Wildlife Center there in Lexington, they had this raccoon, and they had about 50 of them when I was visiting there. And this one in particular, she caught a woman's sweater as the woman walked by, and it broke her leg, and because she was in a cage. And they went through and they put this hardware in there, lined everything up, and put amnion over the top of it. And the raccoon decided to chew out her stitches. So we sedated her for a month. And this raccoon has since been turned out into a refuge. It's a 7,000 acre refuge. And every time somebody shows up with more raccoons to turn loose, she shows up and shows everyone her leg, because she wants everybody to see her leg.
That's amazing.
And
So the
yeah,
raccoon itself greets all the new.
all the new raccoons that show up.
That's so funny. That's
Yeah.
adorable.
So, um, this case here, this was Miss B. She was a 6-year-old Keegan, and she had a MRSA infected leg, in which she was at a major veterinary emergency hospital in the South, and she was there for about 6 months trying to get this MRSA infection to go away. And they could not make it go away, so they sent her home to have her leg amputated. And we went through, we found out about it. Doc Holland went through, he characterized the MRSA infection, pulled pulled some tests on the leg, and it was a methazone resistant staph infection. We went through and injected it with our Stemrap D, and 10 days later, the MRSA infection was completely gone.
So your stem cells actually attack infections.
Yes. And it's not so much stem cells as the amniotic material itself addressing the infection. I mean, you've never seen a baby born with a snotty nose.
Right.
Okay.
Exactly.
And it's so basically the amnion is antimicrobial, it's fibrotic, and anti-inflammatory, and so it's got a lot of natural characteristics. If I go back here just a little bit, and we look at
Yeah,
uh,
I really enjoyed this image and the chemokines that, I never really thought about amniotic fluid having chemokines in it.
correct.
But like you said, the antimicrobial, anti-inflammatory, anti-tumorigenic, natural immune, privileged, interesting, and then antifibrotic, and that's why you're not getting the scar tissue.
Correct. correct.
It just makes sense.
It does, and that's the reason we say we're in the recycling business. They initially Amnion's got a pretty interesting history in that they've been using the amnion on humans for about 4 centuries. And the very first study was done clear back in 1910 at Johns Hopkins University. And so Dr. Davis, he did about 550 cases with amnion in surgery and found the antimicrobial capabilities of it and used it through World War One and World War Two. They started using it on eye wounds in the late 40s and early 50s. Took a little bit of a hiatus during the late 70s, early 80s. Can you tell me why?
Antibiotics or
HIV.
HIV? Oh,
HIV.
huh.
Yeah. And so, and then after the turn of the century, they started treating wounds like this. So that's a human foot. And that is a diabetic wound, a 6 year old diabetic wound on a human foot,
Oh my goodness.
which this individual had had all of his toes amputated. Yeah, yuck. And any idea what the standard of care for diabetic wounds in 2009, what the standard of care? Amputation.
Weird.
That blew my mind. Absolutely blew my mind that the standard of care to fix this wound is to cut the foot off. And I just found that fascinating. I'm like, here we are into the 21st century and we're still cutting off feet. And so this here, um, they went through, and this individual, he needed a kidney transplant and for his diabetes. And he, behind door number one was amputation. And behind door number two was to put this female amnion on there and lay it on there. And he's like, I'll take door number two. And so and lo and behold, this foot that had a pulse ox of 40 in 57 days healed the wound with a pulse ox of 100.
Wow.
The amnion had neovascularized this foot so much and was able to bring such blood flow that it actually healed the wound and improved the health of the foot as a whole.
Now, did it help the kidney?
We have had evidence of cases in which they've treated one thing and something else has gotten better.
Yeah.
Okay, amnion does have a systemic effect and it is attracted to inflammatory signaling. And we know that based off of all kinds of different science out there, but it gets attracted to that inflammatory signaling and goes to treating wherever that inflammation is and rebuilding the tissue.
But amnion isn't solely committed to just tissue. Like nerve endings is a little different and it still repairs nerve endings.
But it's still tissue.
Yeah. When I think of tissue, I think of like tendons, ligaments, skin. So, but yeah, it doesn't have any affinity for anything specific. It's non-denominational in a way. It just goes.
Right, because it's what grew the fetus in it of itself. I mean, it was responsible for helping to grow the organs and helping to grow the surrounding tissue and mature the GI tract and all of that.
So, Brandon, I have another question is, would we be concerned about sex, so female versus male, because of the estrogens and the testosterones?
We have not seen any issues between Between little colts and little fillies, we've not seen any issues that way, one way or another.
And
Um,
do you think it's like an organ transplant or organ receivers often have memory of the donor?
I'll I'll ask. I'll ask in the future.
Yeah. You're like, that horse was amazing at running barrels, and the one that got the amnion is equally as amazing.
Yeah, yeah. No, I've got I've got nothing to confirm that in any way, shape, or form. But
I'm gonna just like spin your brain a little bit.
I love it. I love it.
I think a little different.
Um, so in terms of, let's see, this is
So
kind of an, go
AC
ahead.
ACL tears are really common, ear infections in dogs really common. And then like my own dog who has this neurodegenerative disorder that's causing his right side facial nerve and eyesight to diminish. How do you just treat sub Q on that?
In some cases, we treat sub-Q. In some cases, we treat systemically in an IV application. But most of the time, it's a localized treatment to whatever it is. Things like renal failure, pancreatitis, IBD, those types of issues we typically treat in a more systemic fashion in an IV. So,
So all those cats with kidney failure, you can just run a little equine product through them and it reverses that.
um, reverse is a not so much reverse, just improves the health of the renal tissue of that kidney tissue and makes it function better.
What about heart problems?
Heart problems, that's a tough one for us. There's all kinds of literature out there of using um, human amnion in which at some of the universities they're using it in which to treat a variety of cardiology type situations. We've not had as much success with heart issues, and I'm not certain why. And it's on our wish list. It's on our science wish list in which to spend some more time with the human side. There's really, from a translationary standpoint, there's a lot going on between us and some of the human companies out there that are using these products. So we really try to be a good neighbor in translationary medicine. So
And Brandon, do you think it has anything to do with the fact that the horses are primarily herbivores and dogs and cats are carnivores, that they might have a different requirement for cardiac tissue, more amino acid aspects?
don't know,
Okay.
don't know. Literally, do not know.
I like to
Um,
figure it out, obviously.
yeah, yeah. Well, we would too. And so, other questions?
Do you have any eye photos?
I do.
Let's see
I
it.
do. Ta-da!
Yay.
Eye photos. So this, I mean, this French bulldog, she had um, horrible eyes to begin with, and but she had this corneal ulcer on her one good eye, and we went through, we treated it. This was at day 21. This was at day 41, and just continued to get good improvement out of that. Um, this one here, this is a melting ulcer, so you can see the eye is just kind of melting out of the horse's head. It's kind of gross, but this is a month later
Well, that's
with this.
impressive. I've never seen a melting ulcer.
It's horrible, isn't it? It's just
Oh, what
gross.
causes that?
Bacterial infection typically. And
Nasty.
so, but other eye cases, this one's kind of fun. This was Elmo and Hannah. So Elmo was 25 years old and came down with this eye ulcer, and she was getting treated by the state vet of Pennsylvania. Had been referred 3 times, and Hannah was Elmo's fifth owner. Elmo had been through 5 children prior to, or 4 children prior to Hannah, and the very first child, they found the mom of the very first child that owned Elmo found out that Elmo had this eye issue on Facebook of all things, and she called me. She's like, they're gonna inoculate Elmo's eye. They're gonna take it out. Can you fix it? And I'm like, I don't know whether I can fix it, but we can try. And so we sent product to Dr. Aaron, and she placed it in his eye. This is 5 days afterwards. This is 20 days afterwards. And this is 26 days after treatment.
And is it just an eye drop?
It's an eye patch. So it's a little amnion disc, and it's about 1.5 centimeters that they just drop into the eye. And they do a tarsorrhaphy. They go through and close the eye for 5 to 10 days. But she was pretty happy that she got her pony back.
That's adorable. How cute is that?
But
She looks
Iris,
happier than the pony, actually.
well, that's only because the pony I'm certain is about to buck her off because
Yeah,
that's
I'm
what
gonna
ponies
say
do.
that too. I'm like, this pony looks annoyed.
I'm gonna ditch this little girl just as quick as I can. We're teaching her to ride. Um, this is Rio. Rio had an iris prolapse, and the standard of care for iris prolapses is enucleation. They up until this point, there's not wasn't much hope for it. And this is 10 days later on this, and we've treated hundreds of these now. And all the horses get to keep their eyes, and that's pretty cool. This one here, this is a pretty cool. This is a protruding descent membrane,
Wow.
but no blood flow. 10 days later, after the use of the product, we got blood flow. And 20 days later, we've got sight back and receding blood flow. And that's how quickly we neovascularize that tissue.
It's incredible. And same for dogs, right?
Same for dogs. Yep.
And what about cataracts and things like that that are a little more normal to dogs?
Cataracts, we've not done enough science on. Don't have enough data to talk about. I'm seeing some of your folks are asking about Lyme disease and we are just now starting to really work on Lyme disease and see if we can treat that. Things like parvovirus, EHV1 in horses, strangles in horses, influenza, all of those things we've been able to use this as a bioscaffold in which to improve the health of the organs affected. So
And what about like strangles and pigeon fever?
not done a ton on pigeon fever. I think we've treated half a dozen animals with pigeon fever and gotten really good success. on it, but not enough. I typically want to have a couple hundred cases under my belt before I go to flapping my jaw about it. So,
But also your whole inspiration was founder courses.
yeah, my initial was what can we use for things like performance osteoarthritis in which to treat these horses with something that's going to be a whole lot more regenerative than uh, uh, things like uh, depot and triamcinolone and steroid use.
Right.
So
And on founders or laminitis,
yeah, we treat those with an arterial implant. And so we'll place the product in the pulmonar artery that's down by the fetlock and administer it there so it goes into the hoof itself. So
excellent. Well,
um, things like neurological damage from EPM, we've treated quite a few of those cases, have gotten good success on most of them. We may not resolve all the neurological damage, but have had pretty good success. We're starting to experiment on horses doing interthecal implants with the product and seeing if we can get some better improvement as far as the neurological damage. But I've overall things like IBDD. I can show this case here. This is in a dog. So this here is Kona, male neutered Dalmatian, 14 years old, but pretty significant IBDD, and this is Kona 10 months post, completely off all pharmaceuticals and all medication, and but again, improving active life.
that just makes your heart good, right? Seeing that.
Yep, absolutely. Um, yeah, another question was treating arthritis sub-Q instead of interarticular. Yeah, with our products, everything goes around the joint. We, when right as we were starting the company, there was some new science out that showed that there was no efficacy difference between interarticular or periarticular injections, so in the joint or outside the joint. And so my deal was if I don't have to compromise the joint space, then why do it? And there's since been new science that's come out showing the exact same thing with PRP, that you don't need to go into the joint with PRP either. And so for us, it made a lot of sense. Now we've we've been chastised quite a bit based on the fact that veterinarians, some veterinarians seem to think that, well, if it doesn't go in the joint, it can't possibly work. Well, our deal has been if we get the same results as going in the joint, then why do it? So
Well,
all
and
of our products are administered sub-Q around the joint.
inflammation sends off a signal. So
Right.
I would imagine this is like a heat-seeking missile.
Kind of like that. Kind of
Yeah,
like that. And
excellent.
so, and there's all kinds of science to show that it's going to go seek out the most prolific inflammatory signaling, and it's typically going to treat that first. And so it is attracted to that signaling and addressing the damage as a result of that inflammatory signaling.
And what would be the cost to treat something like that? Because just Hawk injections are like 500.
Yeah, so a set of joints, set of Hawk injections is going to be about $1,000, and you're going to do that once a year. And so, unlike most joint injections that are every 3 to 6 months, ours we just do them once a year. And we've had people doing it now for 10 years, and has had no, as far as what they're seeing is no changes in those joints over 10 years on those highly used performance horses.
And Brandon, what about things like kissing spine and DSLD?
We treat a lot of kissing spine, have great success with kissing spine. Degenerative joint disease, we treat a lot of that, um, and get good success there as well. So,
It's amazing because I've done some PRP on some horses, and the first dose works like magic. The second dose, not so great. Third dose, you probably could have flushed it. And so this is very exciting that it maintains the efficacy year after year after year.
yeah, I mean, and again, I try to get folks not everything you need to know about this technology you learned in high school biology. I mean, it's just we're just recycling what made the tissue to begin with.
Well,
And so it's not like some fancy, and it's not like we're doing all kinds of magical things in the lab. Our biggest thing that we do in the lab is preserve it. And that's kind of our secret sauce, but we're not adding anything to it. We're not taking anything away from it.
when I was a breeding manager at White Diamond, I would always just be so amazed by the embryonic growth is the fact that it looks like a seed, like the brain and the spinal cord seem to be the first thing that showed up, just like a kidney bean or a lima bean in a little kid's science experiment. So I wonder if the amniotic treatment works in layers just like how the baby grows.
I mean, it works very much in alignment with that wound healing cascade, in which it's going to build the structure first, and then it's going to mature that structure and remodel that tissue. Poppy, there's been two things that have blown my mind about this technology. The first thing is the body's the ability to remodel chronically damaged wound tissue. So that 15-year-old quarter horse that was turned out at 10 with a suspensory injury that's now a pasture ornament, being able to pull him in, shockwave the heck out of that suspensory branch or that SDFT that was damaged that didn't heal quite right, and the ability to remodel that tissue and put that horse back to previous performance level, running barrels or jumping higher than they did prior to the injury. And that's just fascinating to me. The other thing is the antimicrobial capability. If somebody would have told me that we would be able to kill viruses like parvo and EHV1, and the USDA would dispatches all over the United States to public outbreaks in which to address them. I find that fascinating.
That's
And
really exciting. And the MRSA being a bacterial drug resistant, it's such a great option because there
right,
are not any options for that.
right.
Brandon,
So
this is really exciting work that you're doing, and I think you're just at the tip of the iceberg. I would love to keep watching you experiment, especially when it comes to cancer cells and things like that, because 1 out of 2 dogs die of cancer after the age of 10.
Well, it's a brave new world as far as we're concerned, and it's something that we have high hopes on as far as where the science is going to take us in regards to a lot of those types of issues. So
Thank you for your time. Go
you
ahead
are very
and
welcome.
quit sharing your screen, and I'll leave the room open for questions if you guys want to ask any questions, unless you need to go, Brent.
No, I'm good. If anybody's got a question, please ask it. Just unmute and ask.
Oh, Poppy, you know I'm going to go first. This is Mary. uh, I'm so interested. I'm actually thinking this might have been something my vet was talking about, but a veterinarian can call your company and consult on these products for the different needs, I imagine. I didn't see the product you were talking about for neurologic support for EPM or Lyme horses. I didn't see it on the website. So is that just something you'd consult on?
Yeah, it's really new for us. Uh, these are our primary indications, and I bet that's really small on your screen, but uh, the damage done by EBM typically is pretty profound, and we're just now starting to spend some time on it. I had a veterinarian who had three horses with EPM, and we treated all three of them, made the EPM go away, and definitely improved the neurological symptoms associated with it, to where a couple of them he was able to go back to riding, and so uh, those types of things are wins in our world at this point. Um, a lot of what we're seeing is it's not whether or not the product works, it's what is the protocol and the route of administration that we use in which to get it where it needs to go. And that's where we
Yeah,
spend a lot of our time in terms of dosing and addressing some of these things. So
thank you.
It's exciting. Oh, I can't wait to see what you guys end up doing. Very fun. Anybody else? Lee, do you have any questions? It's such an honor whenever you jump on live with us. Nothing. And Angel is using your product. Angel is the one that gave me your number. And
ah,
and so you
well,
are
thank you.
advising, and like I said, I've been trying to find a veterinarian to treat my dog's eye. So if I get my dog and cat vet to call you, just like Mary's question.
Yeah, I that's what I spend all day every day doing, is taking vet phone calls. I was on one 5 minutes before we got on the phone together, so or on our Zoom.
Excellent. And let me check Facebook and see if there's any other questions.
Lee wrote a question in the chat, Poppy.
Okay. Would this help with an elbow?
Yeah, any CCL issues, partial tears, we recommend the product for. Full tears, full tear is going to be a little harder for us, but if they're non-surgical candidates and whatnot, we treat a lot of full tears in that aspect. But yeah, any type of CCLs, tendon ligament issues, we're gonna be a good choice for.
And Brendan, if you have like a jumper that's jumping the big stuff, the Grand Prix stuff, would you use this as a maintenance even before something goes wrong?
All the time.
Okay,
That's
because
that's
I have that
primarily that's
fine.
that's primarily what my folks are using it for. All of my big trainers and folks that are going down the road, that's what they're using it for, is more maintenance related, in which to one, keep their horses healthy, and two, in which to be a supplement for when there are missteps. So
What is the route for preventative use? Or does it
um,
depend on the part of the body?
yeah, it depends on what we're treating. Typically in horses, we're treating hocks, stifles, and fetlocks. And basically they're just going sub-Q around those joints. If we're just trying to keep the horse healthy, and we're given Restore Immune sub-Q. It's cheap. It's going to be somewhere between 240 and $300 for a treatment. Folks are doing that once or twice a year, depending on how hard they're going down the road. Um, so
Excellent.
with dogs, they're using the Restore Immune on dogs, in which to keep the dog healthy and maybe reduce some of the other things that they might be on.
And hip dysplasia, things like that, the chronic stuff that everybody just says Adequan for.
Yeah, the hip dysplasia, we're not going to fix that. That's a genetic issue. But we can improve the health of those joints, so that it makes the animal more comfortable.
Yeah, quality of life, regenerative.
Yeah,
Yeah, you might have some few more good years in regards to that,
yeah.
hopefully.
I
Well,
was late jumping on.
yeah, go ahead, Angel.
I don't know if you discussed, Brandon, if you discussed when you don't know what all is wrong, like with Kata's protocol, and I don't have it in front of me, but I know that her protocol isn't your atypical. So,
Yeah, so with it being, and I've had folks who have called me and said, "Hey, we can't find the issue. It blocks to here." All right, and I'm obviously talking horses at this point. It blocks to here. Do I need to go get an MRI? And in those cases, I'm like, if we can get it figured out to where we can address it close, then do that. I mean, um, if it blocks to the fetlock, then let's treat the fetlock and let the inflammation go direct the product from that standpoint. If we're dealing with more systemic type issues, then let's treat it systemically and let it go address the issue. Uh,
so I know with her,
those
I think we're
Go
doing,
ahead.
I I believe with Kata, we're doing systemically and localized. I think you
with
did.
with Animotion Plus.
Yes.
Yeah,
Yeah.
yeah, and I'm
IV
gonna yeah
also,
I'm gonna bet Kata's a little bigger dog,
48 pounds.
48 pounds. Okay,
Yeah.
and probably a little older,
She's 12.
12. Yeah, my recommendation on those larger geriatric dogs is to hit them both ways, because ultimately
Well, and she had the
we
two CL repairs too. Like, not that you're going to remember that. I know we've talked multiple times, but you have hundreds of clients, so I completely understand you're not ever going to remember that. But she had the two CCL repairs on one leg also.
Right,
Yeah.
right. And so all of that I'm going to want to treat locally. If we're dealing with prior CCL repairs, those types of issues, I'm going to want to treat that locally. The reason for the systemic application is because there is bound to be some subclinical things going on there that I want to preempt. I want to get out in front
Absolutely.
of. And so I use the systemic in which to help me address those issues, and they're going to make the animal feel better, if nothing else. And what I've found is that if there is other things going on, I can get robbed of my product in the localized areas in which we put it. And so I go through, I address the local issues, and the animal doesn't get better. And I get a vet and an owner calling me, what the hell happened? This work. And what I have found is that the longer I dig, the longer I follow the case, I find out, yeah, the dog had IBD, and it was early onset IBD, and that's where the product went, and that's what it treated, and so that's the reason that we use it in these older dogs in a systemic. If Kata was if Kata was 5 or 6, I'd treat the knees, and that's all I'd treat. We wouldn't do an IV injection.
So,
Yeah.
so basically, it's like an autoimmune, you're addressing an autoimmune issue at that point.
I'm addressing wherever and whatever is going to steal my product
And
for an
the
inflammatory
heat,
signaling
yeah, the heat seeking missile goes to the most inflamed area
first.
first.
Exactly.
I love that. And
Angel, did I answer your question?
Yeah, I know a lot of people have questions about CCL and arthritis, so I just didn't know if it was if you all had spoken about, well, when you don't know what's wrong or when you know that there are multiple things, like with her, I know that her back has taken a toll because of overcompensating. I know that her, all of her whole body is obviously taking a toll on her because she's overcompensating, even regardless of whether they're in pain or not. Once you have 2 surgeries, you get bone on bone.
Right.
So
Right.
I just didn't know if that had been discussed, and then I kind of wanted to know a little further too, because we're both busy, so we can't always get on the phone together.
Right. Yeah, bone on bone is going to be one of those things that if we're bone on bone, the ship sailed, and we can maybe address some of the inflammation, but we're probably out of the material we need in which to be able, if we've lost our chondral surface there, then we're
Hmm.
screwed. But
Yeah, she's pretty much bone on bone. You know, when I do adequate injections, they do help some, but they don't help a lot.
right.
But
right,
it,
Yeah.
regardless, for her though, this will help with other issues. So
Right.
I do have one question, not pertaining to the protocol that you did for her. She today had another, well, I guess it actually started yesterday, but she had another vestibular um incident. Do you think that this would help with that? And it's not an inner ear infection.
Don't know. Don't know.
Yeah,
Don't have
we'll
enough
see.
data.
We'll see.
find out.
Yeah. Don't have enough data in which to speak to it. The uh, if it's tissue damage related, we're probably going to fix the damaged tissue, which is going to result in the symptoms going away.
Okay.
So,
And
Okay.
Lee just popped in the chat and said string halt or fibrotic myopathy. So that's all tissue. So
yeah, and we've just I that's funny he brings up string halts because we've just started treating. I've had it's these these indications go in waves, and I hadn't treated hardly any of them up until about 4 months ago, and now we've treated quite a few of them as of the last couple of months, and so yeah, I've had good success with that. Any of your degenerative myelopathy, we've had great success with that in treating uh, any of those types of indications.
so Brandon, should Lee reach out to you or should Lee have her vet reach out to you?
Have her vet reach out to me, and or if she's there at the same time she's there with the vet, just give me kind of a heads up. I'm gonna give everyone my, I'm gonna type in my cell phone so everyone's got that.
Do you want me to say it out loud or you'd rather
Sure.
not?
Thank you,
602
Brandon.
918.
602 Arizona.
Yep, 918-2637. If you've got questions, please don't hesitate to reach out and ask.
Is texting better or
Nope,
phone?
nope. I'm over 50, so I've kind of graduated. Would like to talk to you because what's going to happen is you're gonna text me with all the information you think I need, and I'm going to have 14 questions that I need more information on. So,
Okay.
yeah,
And your website's Anicell, ANICELL,
biotech.com.
biotech.com. Okay. Well, thank you so much. And I enjoyed this. I hope you guys all enjoyed this. I have definitely a lot of people that I think I would like to try your product. So,
Oh, very cool. And like I said, any questions, don't hesitate to reach out.
all right. Thank you for your
All right.
time. Take care.
Thank you. All right.